Hey everybody, my name is Sherry McGinnis and I am a student at Indiana State University with their LPN to BSN program. The following PowerPoint slide is going to be a small presentation to help inform everyone on bladder cancer, the risk factors associated with bladder cancer, as well as some of the symptoms that you may see with patients and bladder cancer. So first, this is just a simple brochure that was created to bring out the important points of the presentation, some of the things that we will be going over. So you can see at the top left, there's some pictures of a cigarette smoking and a dog not feeling too well, and it lists some of the symptoms that might be associated and some of the risk factors as well. So just a small brochure that could be given to somebody to cover all of the important facts that are covered in this presentation. So here are our learning objectives for this presentation. We want to advocate for health promotion and disease prevention. We want to increase knowledge base on bladder cancer, educate on the risk factors involved with bladder cancer, increase the knowledge base on the symptoms associated with bladder cancer, and increase knowledge on the resources that are available to obtain more information. So first, we're going to do a quick test. This is just a 10-question test that will just see how much knowledge you have in regards to bladder cancer. So here is the first 2 questions. And here are questions 3 and 4. What is a risk factor associated with bladder cancer? And what are some of the clinical manifestations or symptoms of bladder cancer? Here are questions 5 and 6. Here are questions 7 and 8. And you can always pause and go back to these questions as needed if I'm going a little too fast. And here are questions 9 and 10. So let's get into the presentation. So first, bladder cancer is one of the more common cancers in the United States. Every year, there's an increasing incidence of bladder cancer worldwide. So it's not just a problem in the United States, but it affects people all over the globe. Bladder cancer is diagnosed in hundreds of thousands of patients on a yearly basis. And it's also responsible for the death of tens of thousands of people each year as well. Unfortunately, bladder cancer is one of those malignancies where the common symptoms may mimic other conditions. So the diagnosis of it can be delayed as well as the treatment as well. One of the important things to note as well is that men are at a higher risk of being diagnosed with bladder cancer. It's actually almost a 4 times as much risk than women. So some of the risk factors associated with bladder cancer, these are some of the more common ones that you might see between cases. So age. Older populations tend to be at a higher risk as well, although bladder cancer can occur at any time. Race, African Americans seem to be a little bit more prone than other people. Sex, we discussed this a moment ago, where men are 4 times as likely to be diagnosed with bladder cancer than women. Your diet can play a part in bladder cancer diagnosis. Some additional risk factors are radiation. So if you have been exposed to radiation, that can sometimes lead to cancer diagnosis. Tobacco use, specifically smoking tobacco, that's probably the number one risk factor associated with bladder cancer. I believe it is seen in half of the cases that are diagnosed. So a big correlation between tobacco use and bladder cancer. Environmental factors can play a role. So environmental factors could be any toxins that you might be exposed to, like hair dyes, paints, cigarette smoke, plastics, motor vehicle exhaust, things like that. And then also some medications may be linked to a diagnosis of bladder cancer. One of the more well-known ones is called Actos, which is for diabetes. Another important factor in bladder cancer is genetics and family history. So individuals who have members of their family who have had bladder cancer are at a higher risk of being diagnosed with it themselves. This could be because the individual has the same gene as the family member with bladder cancer, or it could be that the individual was exposed to some of the same toxins that the family member was exposed to, such as smoke from tobacco. Some of these toxins can cause changes in genes and possibly make a person more likely to get bladder cancer. So some of the symptoms or clinical manifestations of bladder cancer, the more common one is microscopic hematuria, which basically means blood in the urine that is only visible under a microscope. There is gross hematuria, which is blood that is visible to the naked eye. Dysuria, or painful urination. The inability to urinate, which can cause somebody to be in retention. Intermittent or weakened stream. Urinary frequency or urinary urgency. Inadequate bladder emptying. Fatigue. Appetite changes. Bone pain, especially with metastasis, nausea, and depression. So here are some types of bladder cancer. There are several, but we're just going to discuss the most common ones. The first being urothelial carcinoma. This is the most common type of bladder cancer. 9 out of 10, even 9.5 out of 10 times. If you are diagnosed with bladder cancer, this is what it's going to be categorized as. The next bladder type of cancer would be squamous cell carcinoma. This accounts for about 2% of all cases, whereas urothelial carcinoma accounts for about 95%. Adenocarcinoma accounts for about 1% of all cases, and then small cell carcinoma and sarcoma account for less than 1%. Here are some web pages that you can use to obtain more information about bladder cancer. It will give you information on what to look for, some symptoms that might be occurring, the treatments that are available, support groups that are available. And it's just a great knowledge base to have access to. Some of these web pages are cancer.org, the Memorial Sloan Kettering webpage, or cancer.gov. You can also go to other hospital websites such as Johns Hopkins. They may have some information as well. Next, we're just going to review our quiz again. So these are the same 10 questions as before, just checking to see if you've learned anything through this presentation. So number 1, the answer is C. That is not a symptom of bladder cancer. Number 2, the answer is C, tobacco smoking. Number 3, the answer is D, all of the above. Number 4, what are some clinical manifestations of bladder cancer? The answer is D, A and B. Number 5, the answer is D, all of the above. Number 6, the answer is B, metastasis. Number 7, the answer is A, actos. Number 8, the answer is A. Number 9, the answer is A. And number 10, the answer is D. Here is a list of all the references I used, and I thank you for your time.